Hello, if this is your first time seeing my face, my name is Kara. I'm a mother baby nurse and a mom of three. I've been a nurse since 2018, and today we're going to talk all about advocating for yourself in labor. This is a topic that I'm very passionate about, so feel free to put this on 2 times speed or put in your headphones and just listen because I hate editing, so I'm going to just kind of talk very freely in this and not do a lot of editing. So I apologize in advance if you don't like that, but let's get into it. I have my little baby doll with me here because it's just very therapeutic holding him. I think the first thing we should get into is talking about birth plans or birth preferences. Now, you totally don't have to write one. However, I don't mind them as a nurse. I know some nurses are like, oh, if you write them, then it's bad luck because it means everything that you put on your birth preferences sheet won't happen. However, they are a part of your medical record. We do look at them anytime we have patients who come in with them. We do look at them and they actually go in your chart. And I think they're a great reference point. Now, I will say the biggest issue with them is a lot of times people write them and they're very, very long. So try to keep them short and sweet. They should definitely be no longer than a page. And I wouldn't write them with just ultimatums. So I wouldn't say, I have to do this. I have to do that. I would say, if possible, I'd like to do this. I would like to do this. And then maybe also have a contingency plan if you write them. So if you write something in there about, I would like to do this, but if we have to do this, or if I need a C-section, then these are the things I would like, if possible, at my C-section. So I just wouldn't use language that's like, we have to do this and nothing else. I would just be open to thinking about other options, other ideas, and even go over it with your provider ahead of time. I brought mine in to my OB, and most OBs are happy to look over them with you and just kind of talk about what's feasible, some things you might want to think about, just put maybe some things to put a little more thought into. But I would totally do one if you want to do one. I would say 99% of the time, most nurses are lovely, kind, are going to advocate for you, be on your side, respect your choices. However, if it is like clearly a major issue, the nurse you have, it is not a good fit for you, like it's bad and it is ruining your birth experience, or you don't feel safe with them, or they're not advocating for what you need or want, then what I would do is ask for the charge nurse, and just tell them, you can tell them what's going on if you want to, but also if you'd rather not say, like if you don't want to say anything specific, and just say like, look, I'm not going to go into the details, but I just need another nurse. Now, sometimes with staffing, it is not always possible for them to immediately switch them out, but typically they can switch you out with somebody different. They'll just do an assignment swap, or just like maybe that you do have to continue having that nurse for whatever reason until the end of their shift, but with the oncoming shift or whatever, they know at least like maybe you need somebody different when the next day comes along, just so you don't get that same person back. So do not feel bad about asking about that. Sometimes it's just not a good fit. Now, I wouldn't just fire a nurse willy-nilly, like if it's something minor, but truly, if it is bothering you and you just are like, look, I need to say something, then don't feel bad and just say something, because it totally happens. And it's not like we're, oh, so offended, because usually if it's an issue where like the nurse needs to switch, there's chances are that probably that nurse like is either been a problem for other people, or it's just a personality thing. Not everyone is a good fit for each other, and that's okay. It's not like we're sitting at the desk like talking about you, and I would not stress about that. All right, next, in advocating for what you want and what you want to do. So let's say that there is something specific you're really hoping to get out of your birth plan, and either your midwife, your OB, your CNA, your anesthesiologist, your nurse, whoever it is giving you pushback. The biggest thing I would say is, if there's something you feel strongly about, know or understand why you want to do that, so that if they question you, first off, if you don't have to give a reason, you shouldn't have to defend yourself, especially in a time and that is as vulnerable as labor or postpartum. It is never someone's place to try and fight you on it. I am very much in the mindset of, if I've given you all the risks, all the benefits, you're an adult, you then, and I've had you sign, maybe you have to sign a refusal form for something or whatever. But if you understand everything and you've made that choice, I am not going to fight you on it, because that is just further going to cause a distrust of the medical system with you. And I am there to take care of you, be on your side, and support you. So I don't believe in like fighting with patients on things, because that's just going to make things worse. But if you are running into a staff member that is fighting you, that's why I think it's a good idea to understand the why of why you want to do or hope to do what you want to do. You shouldn't have to defend yourself. And ultimately, I would even use that if it comes to it. If someone's like, well, why don't you want to do this? So you can respond in a couple different ways. You can say, well, this is the choice I've made for me. Here's the research. This is why I want to do it. So you can stand up for yourself if that's what you want to do. Or you can just utilize your right to say, you know what, I am not in a place to fight with you on this right now. This is the choice that I've made, and I hope you will respect that choice for me. Just you can leave it at that. Sometimes saying less can be beneficial, and choosing not to engage with the person in a fight. For example, let's say you go into your um, an appointment at 36 weeks. And let's say your OB is like, we're going to do a cervical check. First of all, they should ask you and say, would you like to do a cervical check? And they should explain, this is why we like to do it, but here's also the risks as well. So it's kind of up to you. They should be asking for consent first, and not just saying, this is what we're going to do and we're going to do it. So let's say they suggest that, and that's not something you want to do. You're like, nah, you know what? I don't really want to do that right now. It's uncomfortable for some people. Um, there's just, maybe you don't want to do it. There's a slight risk of infection. So let's say you're like, yeah, you know what? I just rather not do it. And they're like, well, why? Why don't you want to do it? You can either say, well, and because if you've done a little research on the topic, you might say, I know that there's like a small risk of infection. It's kind of uncomfortable. Don't really know that it will even tell us that much information at this point. So I'd just rather decline it at this time, if that's okay. Thank you very much. Or you can just choose to say, you know what, I just don't want to do it, and leave it at that. And if they say, well, why? Which they shouldn't keep pushing you, but if they say, well, why? This is why we do it. This is the reason. You can just say, I understand that. I appreciate your input, but this is the decision I've decided to make for myself, and I would rather not engage with any more argument about that. You can say, feel free to put it in my chart that I declined it. I understand the risks and the risk that I am potentially taking on by declining it. But yeah, you can just say, you can chart it and just kind of end it there, because there really shouldn't be any further pushing and pushing. If you have said, I understand, you can chart that, the end. I think education can be power. There's power in education and understanding the whys and the whats, but sometimes there's also power in being polite and just giving your final answer and ending that discussion. So I think you can be kind but firm in your choice. Like my friend Tina says, Mama Nurse Tina, she always says that, be kind but firm. It goes very far for you to be respectful but firm in your choices with your healthcare team. So I don't think there's ever a place for violence in the healthcare setting, physical violence or abuse. I don't think you should ever yell at anyone. I don't think that's ever appropriate. But I do think you can be respectful and kind with your choices, and that will get you a long way, because being in a kind mindset is going people are going to be more receptive to that. If you are giving your answer, if you're saying no, or if you're wanting or you're advocating for a certain type of thing in your birth or postpartum or your pregnancy, um, kindness can go a long way. I just want to put it that way. Okay, next, I want to talk about the BRAIN acronym, because it is so helpful and important during all of pregnancy, birth, and postpartum. So the BRAIN acronym, basically, B stands for benefits. What are the benefits if we do X, Y, and Z? What are we going to get out of this? R is risks. So what are the risks if we do this? What potentially bad things could happen if we do or we don't do something? A is alternatives. What are the alternatives to doing this? Let's say someone's like, the doctor wants to break your water, and you're like, well, what are the alternatives? What if we wait? What could happen if we do it? Like just talking through the alternatives to that option. Let me check my notes right here because I'm going to get lost in thought. Okay, I is intuition. So, what is your intuition telling you? Like, what is your gut telling you about this situation, about what you do or don't do? Because I think your gut, especially when it's your mom intuition about your child, I think it's very, very strong. We're even taught in nursing school to listen to that mom intuition. You know your baby best. So, if somebody tells me something doesn't look right about their baby or doesn't seem right, that is sending red flags and alarm bells off in my head, because you just have more of a different connection with them than I do. I do have that clinical education and that knowledge and experience that brings one thing to the table, but you as their parent also have a an attu- I don't know what I'm trying to say. You are more in tune with different aspects about your baby, and you can tell if something is wrong or different, or you need to do something different. So trust your intuition as well. And then the last part of the brain acronym is N, nothing. So what if we do nothing? What if I do this or I don't do that? What could potentially happen? So I think just applying that acronym to so many different things in your birth experience, your postpartum experience, when talking to providers, nurses, whoever. And a good nurse or a good doctor, a good midwife, a good anesthesiologist, whoever is going to respect that you have questions. It is never okay for someone to just say, well, I'm in charge and this is what we're going to do. Um, a good provider is going to be receptive to you being a part of the care team. I mean, that's how care teams work. The doctors collaborate with the nurses collaborate with the patients, advocate for the patients. It's all a big circle of us working together, and them just closing off that connection and just shutting things down and saying it's this way or the highway, that is not collaborative care, and that can put a patient at risk. I say that all the time with for nurses. Let's say you're a nurse and you call a doctor for an order or for some about a concern, and they just get upset with you. Maybe they raise their voice at you. My favorite way to respond to that is say, okay, well, I'm not going to talk to you right now if you're going to speak to me like that, because we need to work together as a team, as a collaborative team, and for the care and safety of our patient, we need to work together in a collaborative manner. If I don't feel like I can reach out to you and talk to you, like if I feel like you are not interested in what I have to say, or you're going to speak to me in a disrespectful way, then that puts our patient at risk, because then I'm not going to feel like I can approach you and talk to you. Um, so I feel like you could even use sort of that argument as a patient. If you feel like a doctor is shutting you down, a big thing to bring up is safety. Say, I'm curious how you feel like my safety is going to be at the forefront of this if you are just going to shut me down. I'm curious about understanding the whys, understanding why we're doing what we're doing, curious about alternatives. And if you're just going to shut me off or shut me down and not be interested in that, then that could be potentially harmful to the patient. So, lastly, how do I, as a nurse, feel about people doing things against the status quo or wanting to do things that might make my job a little more difficult? So, for example, a big thing is patients refuse a bath for their baby. They just want to wait and do it when they go home. Totally fine. Evidence-based practice shows that waiting longer is beneficial for the baby. Let's say someone refuses, like we wait at least a minimum of 24 hours at my hospital. Let's say the opposite of that. Let's say a patient's like their baby's born and they want to give them a bath right away. I'll educate them and say, actually, the evidence shows it's more beneficial the longer you can wait. But you know what? It's your baby, it's your choice. I've explained why you are able to make that choice yourself. So I'm going to respect that. And that's the end of that. So, how do nurses feel about things like that? People going against the typical recommendations or the policies or whatever. Honestly, it's not a super big deal. A lot of times we might have you sign a refusal form for certain things. Let's say you refuse um, I don't know, like a specific lab on your baby. I'm going to recommend that you don't do that, but it's not like we're sitting there and we're just like bad mouthing you or talking bad about you. I've had patients refuse things, do things differently, all different kinds of things. And it's honestly, it's not a big deal. Ultimately, we're there to take care of you and respect you, and you're an adult, so those are your choices to make. I don't believe in like fighting with people or belittling them. Like I said, it's just going to cause a further distrust of the medical system. And I would say most nurses feel that way, that we're just going to support you. And if you know all of the risks and benefits, and then if you just, because a hospital policy might have to sign a form acknowledging that we've told you all that, then it's not a big deal. So, I hope this helps you feel a little bit more empowered and good about your potential future birth experience, postpartum experience, and even with having kids in the future if you're advocating for your child. Also, I want to point out too that a lot of hospitals even have a patient advocate. Um, so if you, for some reason, if you feel like there's a big issue or you're not being heard or there was something egregious that happened during your experience or your stay, you can also reach out to your patient advocate, or patient's experience. I think some of them are called like a patient experience advocate. I don't know. But you can even reach out to them and talk to them if there was something that you need to discuss after or even during your stay. Sometimes they can come to the bedside and talk to you. So I just want to throw that out there. But I hope you feel a little more empowered and make sure you follow along for more videos.